we're going to do today is we're going to have a little bit of a wonderful little jelly bean. So I'm going to have you pick one right in here, grab the jelly bean, and I'm going to select the same one, and then we're going to take a bite and see how tasty it is.
Okay, I think the lime green one looks good.
Okay, this one with the spots? Okay,
yes.
Grab that one.
All
and then we'll grab this one, and we're going to do a little cheers.
Okay, cheers.
Okay. Oh my God. This is jalapeno.
Is it? It tastes a little different.
It just tastes very different. It tastes like celery now.
Mm-hmm.
Oh, wow.
I am getting celery. Very green, leafy green.
Yep, okay. So speaking of leafy greens, we're going to be talking about collaboration and resilience today in our community. And just so everyone knows, like, can you describe to me what are the social determinants of health? What is that term?
So there are 5 key aspects of social determinants of health, which include healthcare access and quality, education access and quality. And that means whether you have health insurance, for example, if you are exposed to early childhood education, if you graduate from high school, if you enroll in a higher education program. Another aspect is community and social context. So if you experience discrimination in your overall work environment. Another component is economic stability. So if you experience poverty, your employment status, food security, housing security. And another one is just your overall neighborhood and the environment that you're exposed to. If you have access to transportation, the quality of the building that you live in. If your exposure to pollution, for example, and the level of violence and crime that you're exposed to in your neighborhood.
And those social determinants of health can have a negative impact on your health of any patient, correct?
Yeah, absolutely. Social determinants of health are mostly responsible for the inequalities that people experience. For example, if 2 people live a few blocks away from each other, they may have different life expectancies simply because of the safety that their neighborhood provides for them. Another example is lack of health insurance. If you don't have health insurance, you most likely aren't seeing the doctor on a regular basis. You aren't getting these screenings that you need to get done. And so you're at a higher risk for getting these diseases that are mostly preventable.
Well, it's very intriguing. So with that being said, we're just going to dive into this bowl of chocolate sugar again. And I want you to pick another one this time, and then we're going to enjoy, and then we're going to hop into the next question.
All right, let's get the blue one because it matches my nails.
Okay.
So
I hope this is the right blue one because I've had this one before. Good luck.
Right.
Okay, what are you getting?
Oh, this is really nice. I'm getting like a minty peppermint. This is nice.
That's the best one, right?
Yeah.
It just like is a perfect palate cleanser.
Perfect. I love it.
Okay, so another question I have is there's a really term in public health called a phrase that says meeting people where they're at. Can you describe how CCI really amplifies that notion? And just sort of dive into that.
Absolutely. CCI absolutely amplifies that notion. For example, our health centers are located in places that are accessible to our patients. For example, our Greenbelt office is in the middle of a huge apartment complex, and many of our patients walk there. Some of our programs and partnerships provide such a benefit to our patients. For example, our partnership with Hungry Harvest provides fresh fruits and vegetables to our patients that are eligible. We have our WIC program that provides such amazing nutrition services on top of a bunch of other benefits. We also have our Centering Pregnancy program that provides high quality prenatal care and support group. That is my program.
Yes,
absolutely. And we also have our sliding fee scale, which is absolutely amazing. We have so many patients in our community that don't have health insurance, and they come to us and they're able to afford to get medical care, behavioral health, nutrition services, dental care, all thanks to our sliding fee scale.
That's an amazing thing. And okay, so we're gonna do one last one, and then we're gonna have a final our final question.
Great.
Okay.
Let's try the red one.
Which one? Does it have spots on it?
It does have some spots.
Okay, here we go.
And cheers.
Cheers.
I was hoping it was going to be spicy.
This one tastes like a tire.
It has a little fruity flavor.
Yeah, I didn't have that. Nope.
No, really?
Nope, mine tastes like Mine tastes like a Band-Aid.
Oh, that's not good.
It legit tastes like the adhesive that the Band-Aid, it smells like a Band-Aid in my mouth.
I'm wondering why you know the flavor of a Band-Aid.
Speaking of Band-Aids in healthcare. Oh my God. Oh my God. Okay. So another question I have for you is, we're embedded in the community. There's a lot of voices within that community. How do you think we can go about amplifying those voices in the community that may not necessarily be heard at the moment?
So we definitely need to continue fostering and building our relationship with our patients, our community, and our partnerships, providing our patients with an outlet where they can express their concerns and let us know how we can better serve them. For example, during our centering pregnancy sessions, I always ask the moms, how did they hear about CCI? And they always mention things like, oh, my sister came here for prenatal care. Oh, my neighbor's kids come here for pediatric care. And that just proves that our patients are our biggest advocates for CCI. So just continue to listen to them and take their feedback.
Fantastic. So with that, I just wanted to close on one important note, which is that a lot of people think that care is within the four walls of the health center, but really it's about building community and really enhancing community engagement. So one thing that CCI does, which I'm sure you've been a part of in your time here, has been Run Baby Run or the Block Party, which really engages in the community in public health activities or just healthcare activities in general. So with that being said, it's all about being a great community, working through resilience, especially during COVID, which we just experienced, and we're still in it. So I just want to thank you, viewers out there, whoever you are. Thank you, and thank you, Jessica, for today.
Thank you for having me.